Hello students, Instructor Pamela here. I would like to give you a brief overview continuing on the electronic health records and the electronic medical records, or also known as your EHRs or EMRs. Keep in mind, as a healthcare professional, your main duty is to understand how they operate. All computer-based systems all work the same or perform the same functionalities no matter where you work or what facility. What is different, or the distinction, is actually how the programs look. They look different, so therefore it may be a little confusing at first, but remember, they all do the 10 steps within the revenue cycle or whatever other performing tasks they may do. It's just not the revenue cycle as far as the computer-based programs that you'll encounter throughout healthcare. Of course, we have all of the clinical ones as well. So each perspective computer-based program and software, they will be taught to you, you will learn how to operate them, and once you know the functionalities, they'll all be the same across the board. The screens just look different. So with that being said, how can we determine that everything that we're doing on a daily basis is correct and we're in alignment with our goals? And that's through the reports that are created through the EMRs and the EHRs. So anything that is inputted as far as data entry, there is a paper trail. It can be discovered and found, and so when reports are ran on a daily basis, we're able to see if quotas are met, we're able to see who didn't meet quotas, we can see where there was denials, we can see where we have to collect monies that are due or outstanding. So the reports, again, is an overview capture of the day before or a month or even a week. So all of these programs do a whole bunch of special things, and just always keep in mind you're going to be trained specifically when you go to your jobs because they want you to understand how to operate their particular system. Just keep in mind they all perform the same functionalities, they just look different. I usually say over and over again to my students, it's like working Facebook and Twitter. I'm not that much of an online user for those, but I do know the difference between Twitter and Facebook of how they look. They're both social networks and they do the same things. It's the same thing in healthcare. People always ask, or students ask, are we ever going to have one? I would love to see that. That would make everybody's healthcare professional job much easier. All patients' information will be accessed immediately, but until then, we don't. So what that means is most of the programs do not communicate, and so that's why there's so many different computer programs and softwares that exist in healthcare, because none communicate. And how we get them to communicate is by them being on one network. And then where that comes into problems is, of course, patient information identification, HIPAA rules and regulations. Patients' information can be basically intercepted or accessed when we're on one network operating with patient data information. So continue the great work with learning of all the programs that are within healthcare, especially if you're going into the more coding and administrative side. We also have the encoders that help coders basically type in the diagnosis or the procedure or service, and it actually gives you the number opposed to flipping through the books. So again, continue exploring the different programs that you will find as a healthcare professional. And as always, thank you for listening. And until next time, journey well. Instructor Pamela here. Take care. Bye-bye.